week after a percutaneous Z plasty lengthening of the Achilles tendon. If you can see on our foot here, there's going to be a little swelling where you did the surgery. You know, we have a lateral incision which is right above the calcaneus, and this incision we're basically transecting the fibers that are more distal, and then on our medial incision we're transecting the medial portion of the Achilles tendon. This allows us to take advantage of the fact that the tendon basically makes a 180-degree turn, so we're able to slide the tendon in the Z-plasty lengthening. Now, one of the things you want to make sure is you get enough of the tendon released. So I'm going to show you something you can look at 1 week later. We can use the Thompson test, which we use for Achilles tendon ruptures. This is her foot. She's relaxed in her prone position. When I squeeze her foot, you can see her foot plantar flexes. If you look right here, you can see how her foot's moving down. What you want to do after you've done this tendon release, you're going to see a diminishment in the plantar flexion, so that will let you know that you definitely have enough release here. So you're not going to get a plantar flexion. As the patient begins to heal, as some weeks go by, you can retest this and you'll begin to see the plantar flexion come back. You also don't want to rupture the tendon, so you want to make sure that the fibers stay intact. When I dorsiflex over here, I can still feel the fibers of her Achilles tendon, so there's no void in the tendon. And then basically we transect the entire tendon medially, leaving the lateral portion intact, and then we transect the underlying part of the tendon and leaving the superficial intact. So there's no void or any kind of rupture completely to the tendon. So the tendon basically slides from each other in a Z-plasty lengthening.